I saw we had a few more people join, so just calling out that we're giving it a couple minutes for folks to join. We'll call the meeting to order around 1:05. Okay, I think we'll go ahead and start recording, and Nora, I'll hand it over to you.
Okay, having unmuted. So we're going to start with some housekeeping. Closed captioning. Am I on the right page? Yes. Closed captioning should be available to all attendees during today's meeting. If you need to access, there should be a button at the bottom of the screen that says Show Captions. Click on that link and captions should begin to show up. Questions and comments will be taken from OBAC members only until the public testimony portion at the end of the meeting. If you are an OBAC member and would like to speak, please raise your hand before doing so. The Zoom chat feature in today's meeting only allows meeting attendees to message the host and co-host and no other meeting participants. Any questions, thoughts, comments can be sent via Zoom chat to the meeting host and co-host. If you have a supporting resource link to share with meeting participants regarding an agenda item that is currently being discussed, share that link with the meeting host or co-host to share with the meeting attendees. All materials for today's meeting are available on the OHP Bridge Advisory Committee website, which is on the Oregon website. I can read it, I guess, but it seems kind of silly to read the website.
You're all good.
Address. Lastly, we ask that all OBAC members remain on camera throughout the meeting, if at all possible. We love to see your smiling faces. In order to preserve bandwidth, we ask that non-members remain off camera unless providing public testimony at the end of the meeting. All right, so Katie.
Yes. Are we headed to minutes now? Our agenda?
I think we are headed to roll call first.
Excellent. Okay, I'm going to read out everyone's names. If you can come off mute and just tell me that you're present, that would be great. So Debbie. Okay. Debbie, we can't hear you, but I see you did the thumbs up. So
I'm here.
there we go. Perfect. Thank you.
Connectivity issue.
No worries. Mike.
Present.
Okay. Jonathan.
Present.
Angelica.
Present.
Great. Renisha.
I am here.
Great. Nora.
Here.
Michelle. Oh, Michelle, we can't hear you if you're. Oh, no. Oh, a little bit.
You hear me now?
Kind of. It's muffled, but you're there.
I'll figure it out.
Okay. This is a great test of audio. I didn't even think about that. Askina. Askina, if you are here, we can't hear you. Okay. Nathan.
Present.
Great. Brandon. Okay. And Kelly. Kelly, if you're here, we can't hear you. Okay. All right. I will hand it back to you, Nora.
All right, let us move on to the agenda review. So as you can see on the screen, today's meeting will include review and voting on the January OBAC minutes, part 2 of presentations on the OHP bridge funding, public comment opportunities for community engagement, and some reminders about the next meeting before we close. So first, we're going to do that very exciting review and approval of minutes. So we're going to vote on the draft December OBAC minutes. And I would ask for a motion to approve the draft, and October, sorry.
Sorry.
October.
Sorry, Nora. I think that was on me. It's actually the January minutes.
Oh, okay. Sorry. This is what happens when you just read the thing without actually like,
okay.
Oh, we're really cool. Okay. So January, I take it all back. January minutes. Is there a motion to approve the draft January OBAC minutes?
Motion to approve.
Second, Michelle.
Great.
Okay.
So any comments, questions? Awesome.
All right. Then I will go ahead and read through and just say yes or no. So Debbie.
Yes.
Right. Mike.
Yes.
Jonathan. Jonathan, if you said yes, we can't hear you.
Yes.
There we go. Great. Renisha.
Yes.
Okay. Nora.
Yes.
Michelle.
Yes.
Askina. This is also a check to see if you've come online. Okay. Nathan.
Yes.
Great. Let's see. Kelly. Another check to see if you come online. And Brandon. Okay. Back over to you, Nora.
Great. So the next item is the OHA and ODS leadership seats. We have, we're going to take a moment to introduce a couple of new folks. One is Christy Jo Williams, who is filling our ODHS leadership seat for OBAC. And then just re-welcome Nikki Olson, who fills the OHA leadership seat. So Christy Jo, I'm going to turn it over to you for a little introduction.
Thank you. Hi, good afternoon. I'm Christy Jo Williams, she, her pronouns. I am with Oregon Eligibility Partnership, and am the statewide delivery support administrator. I do want to shout out that I am here for Jillian Johnson, who really wanted to be here but is unable to for this week. So you may see her or me. We will probably be tag teaming. Just want to make sure that one of us is here. It's important to us to hear what's going on and to hear from you all. So thank you for having me. Anything else you want me to include, or do you want me to turn this over to Nikki?
I think we can hand it over to Nikki. Thank you, Christy Jo.
Thank you.
Sounds good. Good afternoon, everyone. My name's Nikki Olson. I use she, her pronouns, and I am the Deputy Director at the Health Policy and Analytics Division at the state. So alongside Katie, Laurel, Tim, and others who have been doing this work together. Excited to be here. Been on this journey with Bridge since its beginning, and grateful for this moment to be connecting with you all regularly about how it's going. Thanks.
Thank you.
Thank you. Thank you both so much.
Now we can move on to our presentation on the OHPB. Oh, sorry, too many. All of the same initials get swapped. OHP Bridge funding. And this is part 3 of that set of presentations on plan design cost levers. So we're going to hear from Laurel Swerdlow, Senior Policy Analyst, and OHP Bridge Project Lead for OHA, joining us on this final part of our presentation series on OHP Bridge funding. Last month's presentation by Roger provided some technical discussion on rates and rate setting, including brief discussion toward the end this is what happens when I'm reading and then the page ends. About the various expense and funding streams for OHP Bridge. Today, the presentation will build on that brief discussion and provide an overview of the plan design cost levers for OHP Bridge and discuss the key considerations for each. As a quick reminder, we're only taking questions from the OBAC members at this time. There is time reserved at the end of the committee meeting for public testimony. For OBAC members, Laurel has requested that questions be held to the end of the presentation. And when that time comes, please remember to use the raise hand function so that we can see who has a question. Take it away.
Thank you, Nora. Hi, everyone. Again, Laurel Swerdlow. I use she and her pronouns. As Nora said, I serve as the OHP Bridge project lead. I know that you've been primarily seeing Katie and Tim from the team, but I promise I've been in the background along the way. I'm not just a new face here. I've been supporting both of them over the course of your all's work, and I'm excited to be here today. Again, as Nora said, if we could try to hold questions to the end on this one, each of these slides could probably be an entire conversation for this whole meeting. So I'm hoping that we can kind of get just a broad overview of these cost levers before we start to kind of dive into any weeds. I'd really appreciate that. So just make sure that you're taking notes of whatever questions might pop up so that you don't forget them. Let's go ahead and go to the next slide. So we wanted to have this conversation as kind of, as Nora said, the third part of the considerations related to financing, because as you all look ahead to the work that's coming down the pike, we're hoping to kind of set you all up to be thinking about both what you might want to do in the event of your building reserves in the OHP Bridge Trust Fund. But we also want to be keeping in mind some very real possible hurdles that are likely coming down the pike from the federal administration, specifically as it relates to the likely expiration of ARPA. We've talked about this in the past, and you've seen a slide very similar to this in previous decks, but just to remind you all, ARPA is the American Recovery Plan Act. It was passed as part of a COVID response bills. And as one thing that ARPA does, it did a whole bunch of things, but one thing that it did is it provided enhanced premium tax credits. Because OHP Bridge BHP funding is based in part on those tax credits, those enhanced tax credits have led to enhanced financing for Bridge BHP. We do anticipate that it is likely or possible, I'll say, it is definitely a possibility that those ARPA subsidies will expire. If Congress does nothing, they will expire on December 31st of this year. And so when that happens, that funding will change, and we will be receiving less funding for OHP Bridge members. And that might mean that you all want to make recommendations on possible changes to the program to respond to the changes in financing. So this presentation is intended to kind of help you think about what those cost levers are that you can be pulling in response to this change, as well as more broadly the cost levers that you can be pulling potentially in the event of developing reserves in the trust fund. Let's go ahead and go to the next slide. As a reminder, the legislature and the task force envisioned a program wherein members of OHP Bridge receive CCO services with no member costs and incredibly minimal state funding. It was a key part of the task force recommendations that the program operate primarily within trust fund financing. General fund contributions have been really limited to this program. And so we just want to flag that like all of these plan levers, all of the kind of various considerations that we're flagging for you, those considerations we're highlighting them within the context of minimal general fund allocation to this program. This federal uncertainty that I just mentioned could require a reconsideration of either plan design or of funding structure. But this conversation today is focused on plan design. Let's go to the next slide. So you've seen a slide similar to this in the past as well. When you think about the various cost levers that you can be pulling, there's really four main cost levers. Member costs, covered services, provider rates, and then related to provider rates is other possible payment mechanisms. All of these you can change and would have changes to how much the program costs to administer. So what I'm going to do now is go through each of these levers, talk through ways that you might consider pulling or changing those levers and the change that would have in how much the program costs. So let's start with provider rates. So right off the bat, I want to underscore that OHA does not explicitly control what provider rates are for OHP Bridge members. However, there are assumptions about provider rates that go into the capitation rate calculation that Roger discussed with you all last time. Right now, cap rates are developed using Medicaid rate assumptions. One thing that you all could do is you could recommend that we offer higher, or excuse me, that we use higher or potentially even lower rate assumptions. At some point, decreases to per member per month rates could become untenable. I'll say here that OHA would not kind of recommend lower than Medicaid rates. However, that is something that you all could be considering. And so we want to make sure in this conversation that we're offering kind of the full range of what you all could recommend to OHA. There would be equity implications of using different rate assumptions for Bridge members than for Medicaid. And that's something that we've actually talked a lot about internally. we do want to note along the way for all of these various levers that there are likely operational implications. In this case, raising or lowering provider rate assumptions would likely require CCOs to establish new contracts with providers. So there would be, some type of level of effort associated with each of these that we'll be calling out, and that's when we wanted to flag here. Let's go to the next slide. So new payment mechanisms. There are specifically two new payment mechanisms that we wanted to name here because they were payment mechanisms that the task force really has discussed, and they were some that were discussed actually at our last meeting. Right now, we do not have any type of OHP bridge equivalent for RAP payments for federally qualified health centers. As we discussed, we've discussed a couple different times, but just to reiterate, there are federally qualified health centers who, when they see Medicaid patients, they receive this supplemental payment to sort of supplement the reimbursement that is offered for services. Because this is not a Medicaid program, there's not an equivalent to that supplemental payment for bridge enrollees. And so that's an example of kind of a new payment mechanism that we could consider in the future. Similarly, we do not have currently bonuses for exceptional quality. We're talking here about the quality incentive pool. CCOs and OHA just had various discussions about these types of payment mechanisms over the year preceding implementation of OHP Bridge. And so the kind of recommendation that was given and that we're currently operating within is that during these first few years of implementation, BHP enrollees would not be integrated into the existing quality pool. Other types of these payment mechanisms, value-based payment is another example. Right now, there's not BHP specific value-based payment targets. And currently in the directed payment universe, the behavioral health directed payments are integrated into capitation rates, but the hospital directed payment and the ground emergency medical transportation directed payment are not. So again, those are all examples of these types of payment mechanisms that exist in the Medicaid space that you all could consider recommending be integrated into OHP Bridge. Let's do the next slide. So yeah, so covered services. Federal rules require that basic health programs cover what's called essential health benefits. It's a set of 10 categories of services that are outlined in the Affordable Care Act. OHP is more expansive than these essential health benefits. CCOs and providers, if we decided to offer more expansive or less expansive, anything that is different from the EHBs, CCOs and providers would likely face some operational difficulties to implementing that kind of thing. But this is a space where you do have some flexibility. Again, you have to offer the EHBs, but right now you're offering much more than the EHBs. So there's kind of some flexibility in recommendations as it relates to non-EHB services. There might be equity implications here of offering one benefit to traditional OHP and a different benefit to OHP Bridge members. So that would be a consideration that you all would need to think about. When you try to really hone in on what those non-EHB services are, it's a little challenging for several reasons. And we did a deep dive on this as part of the task force. I think it was, I guess, almost 2.5 years ago now, or a year and a half ago now, a while back. We did a deep dive here when we were talking about the benefit in the context of the task force. And we did kind of a high level comparison between essential health benefits and the benefits that are covered by OHP. The vast majority of services are the same, but again, the OHP benefit is more expansive, and there are kind of 3 main spaces where you see that difference. The first is as it relates to dental healthcare, non-emergent medical transportation, and then lastly, bariatric surgery. Those were the 3 main spaces where there are those differences. So currently, kind of that's how the benefit differs from the EHBs. Okay, now let's look at the last one, member costs, which is, right now, there are none. Right now, kind of the recommendations from the task force were that there be no premiums, and no cost sharing, nothing, no copays, no deductibles, no coinsurance. You all could recommend that OHA add member costs. We were the first state to not have any in their basic health program. Um, it likely would require this wouldn't be just like a switch that we could flip. It would likely require it would require system changes both on OHA side and on CCO side and on the provider side. So it would likely require some general fund dollars to build that system. Um, and there are implications both for premiums and for cost sharing. Monthly premiums would be less administratively burdened for providers and for CCOs, but it could deter enrollment. On the flip side, cost sharing, so things like copays or deductibles, that would provide greater burden to providers and CCOs. As well as barriers to care, but it's also less likely to deter enrollment. So those are some pros and cons that you might want to think about in that space. So those are the levers. And this slide kind of attempts to capture it all, to really focus on what leverage each of these levers can offer. Again, you could recommend that we use higher or lower rate assumptions in the capitation rates that we pay CCOs. You could recommend that we implement those new payment mechanisms that are not currently in OHP Bridge, things like the wrap payments, value-based payments, directed payments, and quality pool. You could recommend adding or removing non-essential health benefit services. And you could recommend that we implement member costs. The next slide tries to offer some of the key considerations for each of these. In the provider rate realm, again, there's a point at which decreases to PMPM rates are untenable. And there's equity implications of having different rates for different populations. In the covered services space, there is a potential for CCO and provider operational issues if services are not aligned across programs. And again, there's those equity implications of covering services that are not available to traditional OHP members. And then lastly, those implications for member costs. Monthly premiums could be less administratively burden. May deter enrollment. And again, cost sharing would offer more administrative burden, but is less likely to deter enrollment. So I think actually let's go ahead and pause. Well, okay, I'll do one more slide, one or two more slides. Yeah. So as a reminder, the task force did offer guidance on these cost levers. Their guidance was this. They said, first, you should maintain existing OHP coverage, the existing CCO service benefit at no cost to the enrollee. Then you should consider increasing capitation rates to enable CCOs to pay providers higher reimbursement rates with specific attention to safety net provider reimbursements. So that was kind of a nod to those wrap payments that I was talking about. And then consider expanding benefits to provide additional services and promote health equity. And this recommendation in many ways was kind of trying to offer thoughts for how to spend trust fund dollars as reserves grow. In many ways, I think they saw kind of what they were offering, like the current plan design, as being the floor. And I think what we're trying to kind of talk about is, okay, but there might be some spaces where some changes might need to happen. And so we'd love to have you all start to think about that. And then the last slide here, again, I want to just reiterate that this conversation is the conversation on the cost side. It's not on the the side of funding streams. Right now, the assumption or the kind of structure, the financing structure, is such that there are no general fund dollars. There are some general fund dollars, but very minimal. And so that's kind of the current landscape in terms of funding that we're wanting to have the conversation in. Okay. I think that's it for me. I hope that made sense. I want to admit now that I'm mid flu, but I think I was able to communicate the key points. So please feel free to please follow up with questions or anything that I said that was nonsensical. Yeah, Jonathan.
Thanks. That was very insightful and helpful too. The previous slide before this one, I just want to had a clarifying question about 2.3, where it says increasing capitation rates to pay providers higher reimbursements. Does that mean pay providers higher reimbursements than what they get for other programs like OHP, or higher reimbursements compared to what?
Yeah, thanks. It's such a fair question. So there was extensive conversation in the task force about the fact that this population this population is currently assumed to be covered, was currently under the time of the task force. When the task force was having this conversation, this population was on the marketplace. Marketplace reimbursement rates are higher than Medicaid rates. So the conversation that was being had at the time was, what is that impact going to be if this population essentially is transitioned to a program that has lower rate assumptions? So in order to kind of make sense of that, their recommendation was that in order to operate within the trust fund, that the rate assumptions that they use to calculate cap rates should use Medicaid rate assumptions. And as reserves grow, that there should be a consideration to use higher rate assumptions as compared to Medicaid rate assumptions in order to address the fact that this population was being transitioned from the marketplace.
Thank you. Okay.
I think I made that more complicated than it needed to be. The short answer is higher than Medicaid rates.
Okay. And then similar question, I think for number 3, expansion of benefits. That would be similar to the what they previously would have been receiving in the marketplace.
The expansion of benefits was expanding beyond Medicaid rates. So, and I'm realizing, beyond Medicaid services. And I'm realizing that this recommendation kind of comes at the end of their broad plan design recommendation. Their plan design recommendation was that we use the CCO administered OHP service package as the package. And that's what we're using now. And so the recommendation that they were making is that those benefits could be expanded and that there could be new benefits that OHP Bridge members get that traditional OHP members get. Again, I want to name that there could be an equity implication there, but it also could be that this population has different needs. So that's part of where we'd like to look to you all for some recommendations.
Thank you.
Yeah, Nora.
Just using my nerd compulsion. Just to be clear, OHP benefits are more generous in terms of the number of things that are covered than commercial coverage. So it's not so much that people who are getting commercial coverage are getting services that are not available to Medicaid folks. It was really about an expansiveness of vision, like, hey, if we had extra money, we could do even more things. Like right now, I think a good example of that might be that folks on Medicaid who meet certain qualifications can get assistance with things like climate devices. They can get some medically tailored meals. They can get help with some rental assistance. So those are things that are not normally covered by commercial coverage ever, but also, are unique to certain Medicaid programs. So.
Thank you, Nora. And I also realize a key thing to bring up here in the context of the benefit package is that the bridge benefit package is the CCO administered OHP benefit. It does not include long-term services and supports. And it also doesn't include the health-related social needs benefit, which includes housing, climate, food. When we were building the program, those HRSN services were also being built. And so we wanted to get kind of both programs under our belt a little bit before trying to integrate them both. So those are other services that are not on part of the bridge benefit at this time. And Katie, just while we're talking, could we go back one more slide to the lever slide? And then I see Mike's hand. Yeah. Oh, sorry. The lever. Yeah. Yeah, go for it, Mike.
Actually, can we go back to the previous slide? I have one question on that. So I know these are the 3 recommendations from the Bridge Task Force, and they say these are the priorities. If we ever get to a point where we're having to make some hard, difficult decisions, was there a ranking of these 3 priorities that they recommended, or are they looking to us to kind of come back and say, here's what we would recommend based on the priorities that you've given us?
These are listed in order of prioritization from their recommendation.
Okay. All right, thank you.
Yeah, and there's like a couple sentences of narrative around this section of the report. And I'm realizing we've sent the report out in member materials, right, Katie?
I actually don't think we have, and I think that's a good idea.
should.
It is publicly available, but I'll make sure to include it for you all
Yeah.
in our next set. Yeah, that's a great idea.
So I guess, can I get a check-in from you all? Like, I do feel like we've talked about these various levers in previous conversations. Is this kind of, when you heard that we were going to be discussing cost levers, like, does this map on to the universe that you kind of already had for this discussion? I'm curious if there's kind of new questions popping up here. I see a thumbs up from Nora. I think I saw a head nod from Michelle. Yeah, Jonathan. Thumbs up from Mike too.
Yes, and there's other questions I have that, for example, knowing what you had mentioned about the end of the year kind of deadline for renewed funding for this program. I forget all the acronyms, but just wondering, like, what has the utilization looked like since Bridge has started? Is it tracking with what was predicted? And meaning, like, do we have less funding at this point in the year that we thought we were going to have, or do we have more? And is that going to extend, out past potentially the end of I don't know, just kind of some of those more logistic questions.
Yeah, it's a great question, and it's such a key factor here. I know we've talked before about how, there is a bit of a data lag in between, like as services are provided and then our ability to really, understand the data behind those. I'm gonna phone a friend in here and call on Tim, if you have more that you'd like to say on this, because you've really been on point.
Yeah, happy to offer a little bit. And I think it's a great question. And I think there's two pieces of this that we are in the process of trying to better understand. And so the first is sort of like, how does our federal funding compare to our spending on enrollment so far, right? And I would say the early analysis, and it's very incomplete analysis, but the early analysis is in 2024, we don't expect significant federal dollars left over in the trust fund after we reconcile for actual enrollment. We tell the federal government how many people were covered. After we reconcile for all of that, we think the money we're getting in 2024 is not going to be dramatically higher than the cost from the state perspective of what we pay the CCOs on a monthly basis to administer the program. Separately, there's sort of the question of how does what we pay CCOs compare to what the CCOs costs are to serve members. And I think that that's sort of speaking to your point about like, what does utilization look like? What do we know about that? And we've started talking with our colleagues in the analytics field at OHA, and we really need at least 6 months past the timeline to take a look at that. And so we're just now 6 months past the very first month of the existence of the program. So over the coming 6 months, we intend to sort of to work with those work with our analytics colleagues and start to dive into the experience of members and really start to look at how their service utilization patterns compare to, say, folks who are on the Medicaid expansion or in other Medicaid categories, for instance, where they're getting services. Is it the same? Is it a little bit different? And so we hope that I hope that 6 months from now, we're able to have some early look at like, what did those 6 months of 2024 look like after we've kind of really put that partial year to rest. And that is in 2024, the population that is served by Bridge is mostly folks who moved over in July, who had been kept on Medicaid during the unwinding through the temporary Medicaid expansion, and we're slowly getting more and more people who newly enroll from the program, either from having no health coverage or from marketplace coverage. And so in the course of 2025, we'll have to sort of consistently monitor the program to see how that changes, how the overall experience of the membership changes as the mix of people changes, and we have a larger portion of the people who are coming from marketplace. Are they getting care in different places, for instance, or not? So I think it is absolutely the questions that are on our mind as staff administering the program, and we have started the process of trying to like work with the folks who look at those numbers to figure out what we can say. And I think over the next couple of meetings too, we can gather more input about what people are interested in knowing beyond the things that are, floating around in our heads.
Thanks, Tim.
Well, I just did a time check and we're way ahead of time. Um, for better or worse. Any more questions on these levers? Okay. Should we take an early break, Katie, or should we?
I actually think if it's okay with everybody on the call, I think we can actually skip the break because we're so far ahead.
Yeah.
So if everyone's all right with that, we can get you all out a little bit earlier today.
Snow day.
Okay.
Snow day
Yeah,
vibe.
exactly.
Okay.
Thank you so much, Laurel. And Nora, I will hand it back to you.
Okay. So welcome back from our non-existent break. We're moving into the public comment portion today, and Katie, as OBAC staff lead, has a quick announcement about the OHP Bridge community engagement.
Yeah, I realized I handed it to you, Nora, so that you can hand it back to me. So that was a little fun toss back and forth though. Yes, hi everybody. So we have received some feedback in our public comment section in the past, basically asking kind of for spaces where folks can engage more with the program as members of the public. And so we wanted to make sure that we're including in these meetings a section that highlights opportunities for that kind of engagement. So we're just going to dive into our first one, which is a consistent avenue that we have for folks who are specifically community partners and assisters. So this group of folks is really, really critical for us making sure that this program reaches all the people that it is able to cover, and that folks know how to navigate things like the application and eligibility process. And so we wanted to make sure there was a consistent avenue for individuals serving in this role to ask us questions and receive answers and feedback and support. So we have a couple of different ways that these folks can get a hold of us. You can communicate with your community partner outreach program ROCs, or regional outreach coordinators, and they will funnel questions that you have back to us. And then we'll kind of engage with them in order to make sure we're getting them the right support and answers for you. You can also send us a written email via our email, which is up on the screen, or you can attend our monthly office hours, which is our Oregon Health News Update webinars. And those happen, as I said, on a monthly basis. They're provided in both English and Spanish. And what we do is collect all of the questions that are sent our way the month prior. We get a group of policy analysts and specialists together, and we get answers written up. And then we give them back to everybody at that presentation. And we just do that approach because we know if one person has a question, it's very likely that everybody or many people have that similar question. So we want to make sure that the knowledge is being shared. So you can see the dates and links to sign up on the screen. I'll post these links in the chat as well. And then there'll also be the PDF of this presentation is always shared on our website following the meeting. It should already be up there in draft format, but we'll make sure the one without the giant draft is posted as well. So it's easier to read, and you can click on the links via that as well. And so the English language webinars are the second Tuesday of every month. And then I believe the Spanish ones are the third Thursday of every month. And they're an hour to an hour and a half long. And we share not only updates about this program, but also about any new programs that are being rolled out in the state, or any updates we think are super relevant and helpful for our community partners and assisters. Okay, and with that, I will hand it back to you, Nora.
Great.
Tag, you're it.
So the OHP Bridge Advisory Committee welcomes and deeply appreciates public testimony. To be respectful of everyone's time and ensure we're focused on listening, we'll not respond to what you share, nor will we attempt to fix or resolve the question or concern that you bring today. We will also not interject to correct inaccurate comments that are shared as fact. We will take your comments seriously, understand it as an important consideration in our work, and listen with careful attention and respect. We want to acknowledge that the time held in our meetings to hear public testimony is meant to provide a voice and perspective from that individual, and is not a representation of the OHP Bridge Advisory Committee, its members, or the Oregon Health Authority. Each presenter is given 2 minutes to share, and in the event that doesn't feel like enough time, we encourage you to provide written testimony, which we commit to reading. To help us keep on time, we'll start a 2-minute timer for each commenter. We kindly ask that commenters conclude their presentation when the timer is complete. Please know that written and verbal public comments will be reviewed and discussed following each meeting by the committee chairs and staff to determine the appropriate next steps. Staff are working to build a tracker for the OHP Bridge Advisory Committee website that will track questions from the public that were posed during public comment and provide written answers. And you are welcome when presenting to share your video, but please keep your video off when you're not speaking to help reduce bandwidth. Yeah, so. Anyone signed up?
We have no one signed up. If you are on the call and you would like to provide public comment, please raise your hand. And we'll give it a minute for people to find their hand raise button if needed. Okay, I think that's an awkward enough length of pause. So we will go ahead and move on to the next section. Let me get the right screen pulled up here. Is that showing the public? Is that back to the slide?
Yeah.
Great, amazing. Sorry for the pause there, everyone.
No worries. Before we close out today's meeting, we have a few reminders. First, if you'd like to sign up to provide public testimony at next month's OBAC meeting, or if you're a community partner or a sister with a question about OHP Bridge, please reach out to the email on the screen. Secondly, if you'd like to sign up for the new OHP Bridge mailing list to receive updates and announcements related to OHP Bridge and the OHP Bridge Advisory Committee, you can do that at the link on the screen and in the chat. So lastly, you can find out more about the OBAC, including its meeting times, meeting links, and meeting materials at the OBAC website using the link on the screen, or it was on the screen a moment ago. Our next meeting, but of course, everyone in the room has already shown their prowess in finding this meeting, so I have great faith in everyone to do that again. Our next meeting is March 13th from 1 to 3 p.m., and we look forward to seeing you all there. Thank you again for attending this month's OHP Bridge Advisory Committee meeting. I'll turn it over for Katie for any final announcements before we close.
Thank you, Nora. And thank you again, everyone, for showing up today. We really appreciate it. As Nora mentioned, all of the links are in the chat, including signing up for the Oregon Health News Update webinars in both English and Spanish. And then there's also links in the chat for the mailing list, which we just launched last month. It's where we send out all of our updates about this program, as well as updates about the OHP Bridge Advisory Committee. And then we've also got the email for our OHP Bridge team as well. So for our community partners and sisters who want to send in questions there, we do want to highlight if you or someone you know is trying to reach out to that email for help with their application, that is not the correct email. It's just some policy folks on there. So we aren't able to help you with individual cases. So that's, you go through the one system and your community partners and assisters to help with that kind of assistance. So just want to call that out. I will stay on the call for just a moment or two after everybody heads out so that people can access those links in the chat. But otherwise, we look forward to seeing you all next month. Thank you, everyone.
Thanks, everyone.